welcome to the morning show. We're coming to you this morning on Channel 9 on WJOP-LP Newburyport at FM 96.3 and also on Newburyport Community Media's YouTube channel at ncmhub.org. I'm your host, Mary Jacobsen, and I'm just delighted to welcome this morning's guest. Dr. Alison Volturo is here. She's a Massachusetts native from Princeton, and she's also a graduate of Northeastern University, where she received her bachelor's degree in film and communication studies. She got her doctorate in veterinary medicine from Tufts Cummings School of Veterinary Medicine, and she has a special interest in ophthalmology, surgery, and general dentistry. And in the service of full transparency, I happen to know from personal experience what a compassionate, caring, and incredibly capable veterinarian she is, since she took care of my late great Labrador, Parrish, and she's currently taking excellent care of today's lab, Scout. So Dr. Volturo, first of all, welcome, and thank you so much for taking time to visit the morning show.
Absolutely. Thank you for having me. This is so exciting. I've never done anything like this, so please bear with me. And
Well,
and to give another shout out to both Parrish and Scout, who were fantastic. Parrish is a fantastic dog. Scout, who is a fantastic dog.
well, thank you for that. And it's an honor to have you here. I wanted to start out, I was curious about your career history, because you started out studying different things at Northeastern, and I guess we're headed toward a career in entertainment law. So what made you decide to make the switch and devote your career to veterinary care?
Yeah, quite a big jump between the two there. I've always wanted to be a vet. I've never been naive to the fact that it is a lifestyle. It's not a career. It is not a glamorous career by any means. And you, having grown up with a physician father and my brother who is also a physician, I've been understanding the discrepancies between human medical costs and veterinary costs and the struggles between the two. So I tried to suppress that side of me for a long time. I wanted a glamorous career. I wanted to be able to support myself. And I went to that entertainment side. I love movies. It's one of my big hobbies. It's one of my big passions. And when I realized through starting a job and having my big first job after school, I wasn't feeling fulfilled. I was going to work, I was doing a job, but I wasn't having a career. And it was in my first week at a law firm that I remember it very, very clearly. I was sitting in my barn with my mom as we were taking care of the horses, and I was crying because that was not what I was supposed to be doing. I knew it deep down, and I was trying to figure out how after college do you navigate switching careers. And she looked at me and she said, you go back to school, you take your sciences, and you get a job in veterinary medicine and see if that is for you before you devote a huge more chunk of your life to something that you don't know for sure. So I went back and I did my pre-vet courses. I started working at a cat exclusive hospital, the Cats Hospital in Wellesley, and I have never looked back. It has been something that has been felt like it was a calling for me. And even at the lowest of the lows, I still get up in the morning and I say, I'm happy to go do a job. I need to make a difference now. And I am so happy doing it, even on the days when it's terrible, because I know I'm making a difference and I know I'm feeling fulfilled and I know this is what I was supposed to do, to be able to help out other people, not just animals alone.
Yeah, helping animals is helping people.
Yes.
Absolutely, because we love our furry family members, as I've known you to call them, so
That's
much.
exactly what
And
they
so
are.
it sounds as though your career in veterinary medicine took a little while to launch, but it was meant to be. It
Yes,
sounds as though you found your destiny,
exactly,
so to speak.
exactly.
And I'm speaking personally, I'm glad you did. So I wanted to ask you, it's summer now. And I was hoping to ask you about what are some of the most important things for pet owners to know about adjusting the way you care for your animals when it's as hot as it's been, and it's going to get hotter. Hot pavements, hot cars. What are things that pet owners should keep in mind during these hot summer months, Dr. Voltoro?
The biggest thing to remember is that these guys are walking around with a jacket all year round. So, your huskies, your shepherds, your long-haired dogs are going to thrive in the fall, the winter, when it's really cool and comfortable for them. Summertime, they're going to be more lazy, and that's okay. And it's also one to realize that when they're walking on hot pavement, hot concrete, bricks, anything like that, if there is a patch of grass for them to walk through, keep that going. These guys have fur between their toes. Their feet are going to stay warmer. And it's actually the only point of access that they're going to exit their heat through. So you'll see sweaty feet. If we have an overheating animal, we'll put alcohol on their feet, actually, because it'll rapidly cool down their feet as well. Me personally, I have a dog with separation anxiety. So the biggest thing for me to remember and remind myself is, once it hits about 60 degrees outside, he can't stay in the car anymore for me to go to the stores or anything like that. And the biggest thing too is, if you do have to run errands, make sure you have somewhere the dog can go if you can't leave him at home. And this way you're not trying to run into the store and run right back out to the car to your dog. Cars will actually get about 30 to 40 degrees hotter internally than the external temperature within only about 10 minutes. And me personally, I'm not a 10-minute shopper. I've got to go in and look around and whatnot. And even a cracked window isn't enough. There's not enough circulation going through that car to keep your dog cool. The other thing I always tell owners is, swimming is excellent. It's a nice way of cooling down animals, and this way they get a little activity out of it. The biggest thing with that is to make sure they dry off thoroughly, ears and full body, just because once that water hits and stays trapped, you're liable for something like a yeast infection, especially in the ears. So I'm definitely a huge what's the word I'm looking for? A huge supporter of swimming for animals, but definitely the drying part after as well. And then lastly, always carry fresh water with you wherever you go. Certain ponds and streams can be contaminated. Most dogs' immune systems will actually fight off a lot of those bugs that are in there, but for that sensitive dog, or if they're down and out for any reason, fresh water helps. And then also salt water. Dogs love to guzzle salt water, and that could easily send their GI tract off the rails, as well as their electrolyte imbalance. So fresh water is key, even if it's a bottle that you're pouring into your hand for them to drink out of.
Yeah. Oh, that's a great list. Thank you so much for that. And particularly focusing on the importance of drying them off, which I wasn't. I mean, with the lab, they have kind of an otter's coat, and they shake a few times and most of the water is gone. But I've had long-haired dogs before. I grew up with a Samoyed and a German Shepherd. And not only do you need to dry them off, but they have wet dog smell as well. So it's a good idea to dry them off for many reasons. It's such a distinctive smell. So thank you. That's a great list, and important to remember how quickly cars can heat up in the sun. Like, I'm glad you focus even within 10 minutes. That's a dramatic kind of increase in temperature. So important to make sure that you keep that in mind. We wouldn't want to sit in a hot car with the windows closed or just cracked. So anyway, thank you for that. That's a great list. Well, I wanted to kind of following up on that, I wanted to ask you, what are the most important things that as you encounter dogs or cats in your practice, what are some of the things you say to yourself, oh my God, I wish dog owners just understood this better about, the dog's needs and their behavior?
Yeah, so the biggest thing in practice is actually fear aggression. Whenever we talk about a dog biting, lunging, acting out, the first association is it's a bad dog. And I am a firm believer that there is not a bad dog out there. There's dogs that are poorly socialized. There's dogs that don't have manners, things like that. And you have to be able to adapt, especially as a veterinarian, to figure out what's going to be the best method, the best way to handle that animal so we can get things done. We've been talking a lot in my practice lately about people thinking veterinarians and their staff have these magical powers about handling these animals, and we don't. We know how to read them and understand their needs just that little bit better, but we can't get them to a point that the owner is hoping they'll be in the vet office without the help of the owner. And a lot of it comes down to socialization, a lot of touch and positive reinforcement at home. So for dogs who don't like nail trims, and same thing for cats, just grabbing a paw. You don't have to do it forcefully or abruptly, just casually, and getting them used to those touching behaviors. And there's no shame in a dog or a cat needing a muzzle. It is simply for everybody's safety and protection in the hospital. Obviously, we don't want to have to go right to that. But if we need to get things done, and an owner wants to do whatever treatment's necessary as opposed to work on the behavior side of things, that's the best tool that we have. One of the biggest things that's becoming a new, pretty standard protocol in vet med is offering what's called the chill protocol. And what that is it's 3 medications, and you can use one all the way up to all 3, set at different times to make their efficacy appropriate for the vet appointment itself. And then hopefully have it be worn off about an hour or 2 afterwards.
Yeah.
And the goal is not to drug your dog. I don't want a zombie walking into my office. Yeah. I want a dog that can walk in, or this applies to cats too, to walk in with confidence and be okay, or not really care what I'm doing. And then this way it can end on a positive note and end with a positive reward, in hopes that down the line, we won't have to use the chill protocol, but enough to be able to help us get to that point.
Yeah.
And then the other biggest thing too is there's no shame in using trainers or behaviorists or anything like that, both for cats and dogs, to help them, better be able to manage their emotions, their behaviors, and gain that confidence in there. I always, when I have we'll call it, for lack of better words, a failed visit where I can't get anything done, I make sure that owner leaves there knowing that we don't think their animal is a bad animal.
Yeah.
It's a huge part to understand, and that it's all in fear. And you can see it in humans as well. People will act out in fear. And not everybody that's doing bad things is that sociopath we think they are. There's always a reason behind it, and trying to boil that down as an owner can be super, super, super tricky. And then to try to do it for a 20-minute appointment, there's no time. So it's everything is a work in progress, unless you're lucky and you get that super happy-go-lucky animal who could care less about anything in the world, and they exist out there, but they're the fewer and far between.
Well, that's really helpful. I mean, I think just the using the concept of fear aggression, that when a dog is showing those kinds of behaviors, they're defensive, they're scared of something, and helping owners, I think it kind of, instead of saying stop your dog's aggression, think of it as help your dog feel confident.
Exactly.
And that kind of flips the goal in a very constructive way. And there's lots of ways, as you point out, to work on it. And there's no shame in working on it. There's nothing wrong with your dog's not a bad dog, and you're not a bad owner. You just may need to find the right resources, whether it's a transient use of medication, as you were talking about, or whether it's finding a trainer who can work with you to help figure out what your dog needs in order to feel more confident. Whether it's, clicker training with constant treats, works for a Labrador, I know. Anything with food. I don't know what I'd do if I ever had a dog that didn't like food as a reinforcement.
But yes. At the lab specific, we have a saying, we know there's a problem when a lab isn't eating.
Yeah. So that's very helpful. And it's interesting that you mentioned that that you can use training for cats as well, because that's not something I would necessarily have thought of. You just don't hear about cat trainers, but apparently that tell us more about that, Dr. Volturo.
Yeah, so there's lots of ways, and certain cats will absolutely be food motivated. And you can do some treat training with them. Where a trainer comes in hand is actually, and feline specific tend to be sort of a dual trainer behaviorist, is understanding your cat's needs in the home, and there are cats out there that cannot be indoor exclusive cats, and it's a tricky territory to get into, especially depending on where you live. Personally, me growing up, we couldn't have outdoor cats if we wanted them to live a long life. We grew up in heavily wooded areas. There were coyotes all over.
Oh,
And
yeah.
even in the best of circumstances where we would bring them in at night, there was the occasional night where the cat would stay outside and would never come home.
Yeah.
And you try to find that balance for your specific cat. Where that behaviorist or trainer comes into play is going to be, if you can't get your cat outside, what can you do in home to give that mental stimulation,
Yeah.
and keep them happy. A lot of the cats that you see stalking owners in the home, biting, lashing out, tends to be a stimulation thing, in that they're not getting what they need in the home, and they're trying to tell you that with the only
Yeah.
language they know how.
Yeah.
And there's plenty of people out there. They're not as popular as dog trainers or things like that, but there's even TV shows about, I think he's the cat expert or the cat whisperer,
Yeah.
Jackson is, I know him by name. And they're definitely out there to be able to help you with this. I think the reason part of that they're fewer and far between is the cat is now becoming more of a family member in the home rather than just a cat, the wash and wear pet. And the more that they become a family member, the more we'll have techniques to help them, and the more that we'll have behaviorists and trainers more at the ready to be able to give you guys guidance.
Yeah. Well, that's really interesting because as we were talking about the phrase fear aggression for dogs, it sounds as though we might coin the phrase boredom aggression
Yeah,
for cats. But it's still aggression.
yeah,
And you still
yeah,
need to do something to help your cat be stimulated. I guess enrichment is what they talk about. I know in
exactly.
enclosures with wild animals or rehabbed animals.
Ex-
So there's a use for cat whisperers and cat trainers as well. And that was really interesting. Thank you for that, Dr. Volturo.
Absolutely.
Well, I wanted to ask you something I think, dog and cat owners are very interested in and sometimes wonder about is how can you tell if your dog or your cat is in pain or suffering and that it's time to take them to see the vet?
Yeah, so dogs are going to be a little bit more upfront with their behaviors, physical behavior, so limping, shying away to touch at certain areas. You can generally pick that up with a dog. Decrease in appetite when they're normally a strong eater, shaking their head for looking at their ears, slowing down when they normally wouldn't is can be a more subtle sign of heart disease or something happening that's draining their energy when it normally wouldn't. Some dogs will be hiders. If they're normally a social dog, they tend to go off on their own, or they get grumpy. And a dog that would normally let you come right up to them, lay down, pet them, whatever, starts growling at you when doing it. And it doesn't always have to be a systemic issue, causing them to be sick or anything like that. It could be something behavioral, a change of sorts, and we don't pick it up. If that happens, we come in, we have a normal exam. Typically there's something else that we're just not catching on to, and then we ask owners to try to look for patterns, changes,
Yeah,
anything to give us a clue as to what's
yeah,
happening. Cats are going to be even trickier. They tend to be hiders, and that's generally what you'll just see when there's something off. Some cats will be more upfront. You'll see a decrease in appetite. You'll see changes in the litter box. The blocked cat will always, or I shouldn't say always, will generally be hanging out around the litter box, crying as if they're in distress. And they're trying to tell you it's something with the bathroom habits. But cats will tend to hide more of their symptoms. And one of the things we'll use more for cats than for dogs is actually a weight gauge. And if they're dropping weight progressively or really quickly, something's changed, either systemically or they're sick in the moment that's causing that. And weight, actually, cat owners will pick up on if there's no other signs, because they'll pick up that cat and say, hey, feels a little light today. And then we start running blood work and tracking down problems that way. But I guess the biggest takeaway is to look for changes in patterns and behavior, to
Yeah.
see, is there anything different than what normally would be. And then you sort of use that to gauge, well, is it a big enough change to bring the animal to the vet? Is it a small enough one to watch over 24, 48 hours to see if anything else emerges? And we have no problem getting on the phone and chatting, or talking through technicians or receptionists to say, yep, that's okay, watch it for another 24, 48 hours. Or no, we've got to see this pet, something's definitely up, and we've got to try to boil it down a
Yeah.
little further. But it is tricky business. It's tricky for us to find it out in an exam, and it can be even trickier at home for people to notice, especially for something as that's a small gradual change.
Yeah. Well, that's enormously helpful. Thank you for that. I think the key that I take from what you're saying is, just be on the alert for changes. You know your dog, you know your cat. Although it sounds like it's a little trickier with cats.
It, i- it
But
is.
look for changes in their behavior, and then see if it's a pattern
Exactly.
that's developing over time. So there's some detective work involved, as well as just like with cats, it sounds like physical changes in their litter box behavior. And just if you feel that they're losing weight, that's something to really look out for. And then call and talk about it, and ask your questions and get some answers. So thank you. That's
Exactly.
really helpful. Well, we were
Absolutely.
talking about cats. I noticed something in your online profile that I didn't know what it was, but I hope you could. But I was intrigued by it. It said that you're fear-free certified in feline handling. And could you tell us what that is?
Absolutely. So what it is, and it's a huge movement across veterinary practices now in general. Relatively new when I was originally certified and found out about it. But a lot of it is all fear-free handling techniques. So how to handle a cat without scruffing them. And I will be honest, I am feline fear-free certified. I haven't done much of the dog side. Um, but a lot of it from what my technicians have actually taught me too is again restraint techniques, so that as you're restraining, that animal's not getting more amped up,
Yeah.
and reacting and lashing out further. Cats specifically, the fear free is sort of that golden outlined book of what you can follow. It is not applicable to every single cat out there.
Yeah.
And it's tricky as well, because the standard of practice has always been, when you handle a cat, you scruff them to restrain them. And as the world's shifting in veterinary medicine as a whole, we're trying to move away from that as well. And in order to do so, you kind of have to get everybody on board
Mm.
with those techniques. But I have found through my use of them for cats that you're more likely to get more done and keep everybody safe and happy while
Mm.
doing so. There are a handful of cats out there that will tolerate about 90% of everything except for being scruffed. And to be
Oh,
able to use techniques that you otherwise know to do things to cats, other than scruffing, you helps you out with those handful. But it also makes the experience a lot better for the other cats that could have cared less about a scruff, but are happier not being held down that way.
yeah.
And I mean, if you are uncomfortable as a restrainer following those techniques, there's no shame in using cat gloves. There's no shame in using a towel to protect yourself,
Yeah.
if that means you're meeting your patient halfway to keep them happier and comfortable. And there have been several patients that I've jumped in myself to restrain and had technicians give vaccines to, because I can't explain what needs to happen in that short period of time. And the longer we take, the cat's clock
Mm.
seconds tick down even more.
Yeah.
And what usually happens after those situations is we get what we need to get done. The cat goes back in the carrier, and then I explain what I've done differently, so my technicians can continue to learn. And I would say it has made a huge difference for cats in the vet practice. Um, the other piece of that is cat exclusive hospitals out there. have done great for fear-free as well, because that brings it to that next level. It's not only cat restraint and handling, but then you're doing environmental modifications, and the whole clinic is built around the fear-free model, which I think has done huge for cats in general as well, especially as they're becoming more of an established pet too, and we're seeing more and more standard annual care for cats, which is wonderful. And even, we can use some of those cat fear-free techniques on little chihuahuas. So it's even great because you're more likely to get bit by the chihuahua than the shepherd.
Yeah.
And that's just simply the real estate you have to work with when they're being fearful. And it's been great using some of those techniques too. So it's continuously a learning experience, and I'm probably overdue for being recertified too. But no, I'd say it's made a huge difference in the field as a whole.
Oh, that sounds really wonderful. And thank you for that, that thoughtful explanation. It makes perfect sense. And it
Yeah.
sounds like it has really good results. So that's really wonderful, Dr. Volturo. Well,
Absolutely.
I wanted to ask you, you made some reference about, veterinary care and changes in veterinary care. And I know that in veterinary care, as in, excuse me, human beings medical care, they're making advances all the time. And you can do more stuff all the time. And so I just wanted to ask you if you could fill us in on what are some of the advances in veterinary care that you find most exciting?
Yeah, so for me and for what I do, the biggest advances tend to be in the form of drugs, and a lot of the post-op pain medications coming out right now. There's two big ones. One for cats, that's brand new, and one for dogs that's been around a bit longer. And I'm pretty sure it is safe to use in cats as well, but it's not nearly as integrated as much anymore, or at this point. But a lot of these drugs that are coming out are offering more than 24 hours of pain control, and that is huge coming out of surgery. One of the biggest questions I always get with surgery is how long do I run these medications for? And a lot of the time I'm having people just judge if they think their animal is in pain or need some sedative side effects from them. And the one in particular for dogs, Nocita, I was actually part of a pain study for that specific drug coming out of TPLO, so ACL surgeries in dogs. And there was a noticeable difference within 12 hours, because we were pain scoring these dogs at 2, 3, 4 in the morning, and there was a noticeable difference between dogs who received it and dogs who didn't. We were blind to this during the study. We didn't find out until afterwards, but we put our guesses in at who got it and who didn't, and both my colleague and I, who were doing the pain score, were nearly spot on for everyone. And my hope is, with this new post-op pain drug for cats that's out there, we're going to see those same results. And those are the most helpful to me in practice. Now, going to our referral hospitals and technology that's emerging there, there are advances day by day in that, and more people in those facilities are becoming more comfortable with the tools that they have at hand. Endoscopy, it's not new, but I'd say it's more up and coming, as well as some of the other big surgical techniques. One of them being laparoscopic surgery, a smaller incision.
Yeah.
You're going in with tools as opposed to your own hands, and for some procedures that can make a huge difference in recovery time. And I think the more that we use these tools, the more that they're becoming known to the public as well. We're going to see them used higher and higher in veterinary medicine, and they may eventually meet somebody like me, depending on how my surgery changes. But there's constant thought with that, and there's constant changing and adaptability to see what also can we use from human medicine, in animal medicine as well, that's comparable, and vice versa. What can human medicine use from us? And the more we think with this One Health perspective, the more that it's going to come about, and we're going to see huge things for veterinary medicine.
Well, that's wonderful. I'm having a 10-year-old dog. I'm really glad to hear it. And with the laparoscopy and the small incision, so you can do treatments that are much less invasive and don't bring as much potential hazard for the animal. So that's really great to hear. I wanted to ask you about something that is, it's one of the hardest decisions that that pet owners have to make and that veterinarians have to help them with. But it's something every pet owner has to deal with, and that's end of life care and the decision to euthanize an animal who's gotten to the end of its run. So I was just curious if you could talk a little bit about when people look to you for advice on this, and probably every day you have somebody, maybe not that often, but excuse me, what do you encourage people to consider when they're confronted with that decision?
Yeah, a lot of it is case by case, so it is tricky. But the biggest thing is to look at the whole picture, and there is no way I'm going to step in between your emotions and your pet, because I just do not have that power. There's such a strong bond there. But what I ask of you is to take a step back and look at the animal's quality of life. We use 5 basic measurements: so eating, drinking, urinating, and defecating on their own, and playing or being interactive. And once they're doing less of those things than they are, that's when our quality is going to deteriorate. And then once you're down to one thing, maybe they're only drinking for sustenance, that's not a quality of life to live. And I am a believer in euthanasia. I do think it is that one last thing that we can do to ease suffering, when we know we're not going to cure a disease, or we know it's only going to continue to go downhill. And it is okay to make that decision. A lot of the time that I spend talking to owners is telling them that it's okay, and that I'm comfortable. I will always refuse a euthanasia if I do not think it's appropriate, and I have that right, which is great. Um, but a lot of the time, I'm not being confronted with euthanasias that are inappropriate. They are very much appropriate for the situation. And depending on the disease process, they can be very different from the situation, which is why the 5 things really come into hand. I'd say my worst ones are going to be the dogs that have terrible arthritis where they can't move. And those are the hardest to see because the mind is still there.
Yeah.
And those dogs will absolutely keep living for you. So it's your turn to say that it is okay to let go.
Yeah.
And it can be a battle sometimes. And I always tell people too, you can cancel that euthanasia 100 times over. I will not fault you. I will not care, because I'm happy I don't have to go through with it. But to have it on the books, to be prepared for that side of things is important too. And they can rest assured that every veterinarian has had an animal of their own that have gone through it. And so they're not alone with going through it either. We do not judge anybody for their reactions at the time of the euthanasia, and we do not judge anybody for the reasons that they're choosing a euthanasia either.
Yeah.
And it comes down to this feeling that you will get when it's time, and no words can explain that. I've been through it with my own. I've been through it with several clients. Is you will get this gut feeling, this inkling of it's okay, it's okay.
Yeah.
And that's the time when you're ready. There should be no regrets with euthanasia. I've had people tell me that they feel like they've waited too long and they need me to tell them when they can't wait any longer. And I have no problem doing that. I come from a non-biased view when I'm looking at your pet, and sometimes you just need that help, and that's okay too.
Yeah. Well, those are very, very wise words, Dr. Volturo. And I think it's helpful to have the just the framework of the 5 things to look at. And it's clear that you're recommending that people not be judged or judgmental about themselves. And I always see it as the last act of kindness you can do for your dog, no matter how sad it makes you. It's still kind when the time's right.
Absolutely.
So, well, something else I wanted to ask you about, because I have a friend who's a veterinarian, and she's often will talk about how, oh, human doctors, they only have one species to master, and we vets, we have hundreds,
Oh, yes.
Oh, it's just curious to find out, what's the most unusual or challenging species that you've been asked to take care of as a vet?
So I'd say they're completely separate. So my most unusual is actually a giraffe.
Oh, no kidding.
I had the privilege of working with a giraffe in vet school, and he was fantastic. He was so sweet, so curious, and it was so cool. I have pictures from it, and you can see how happy I am in the pictures.
I'll bet.
But I knew too in vet school I wouldn't work with anything nearly as cool as him in my career. So I definitely took advantage there. I'd say the most challenging is actually a pig, because they tend to be, their weight size is solid mass. So if they want to throw it at you, they will. And they tend to not be amenable to much handling either. And I remember in vet school, I was working with a pig and trying to give her fluids in her ear, because that's the biggest vein that you can hit, and that 14 gauge needle went right through my thumb, not into the pig's ear. And 3 o'clock in the morning, I was looking at the technicians working with me, and we were all like, we just want to go home. And we all powered through, we got the pig what she needed. But I'd say across the board, working with pigs can be super challenging. They can be mean, they can be nice. There are plenty of nice pigs out there, plenty of pet pigs that are out there too, but they are tricky, and they tend to scream through any treatment, even if it's not painful, and that can be pretty jarring to yourself as well. But yeah, it is not the standard cat and dog that I typically work with.
Well, those are both great stories, and you just illustrated the point about how you have to deal with everybody when your two examples are a giraffe and a pig.
Got it. Yep. From the tallest of the tall to the smallest of the small.
Well, something else that I wanted to ask you, because I'm just curious about this, is there's so many, there's Animal Planet. There's so many TV shows now about vets and different kinds of animals, and so I just have to ask you, do you have any favorite shows with veterinarians?
I would say my favorite is actually All Creatures Great and Small.
Oh, well.
It is
Old one or new one or both?
Both
Yeah.
of them. It is a fantastic depiction. There are so many truths in it, even though it is, the newest being relatively fictional. But it is such a nice break from reality to see that, and I can laugh and I can cry and I can relate to it as well. But it is still a break from my reality. And I don't watch too many of the Dr. Poles or those shows, just because that's what I'm doing in my daily life. But if you want a glimpse into what vet med is like, that is for sure the place to go, because all of them will depict both the glamorous and the non-glamorous side, and give you a true feeling of what it's like. And sometimes I will watch them for the large animal aspect, but I tend to stick with the fictional side of things, because it keeps it lighthearted and it gives me a break.
Well, it's just one of the best TV shows ever made, old and new. And I do recall, Dr. Volturo, an episode in the old and the new one where there's a really scary hog.
Yeah.
That is tyrannical.
Oh, yes. And that's pretty much what it's like working with pigs.
Well, I have one final question for you, and I would just like to ask you, what brings you the most joy in your work?
It is when I can get a client on the same page as me, we're working as a team to get the animal what it needs, and it's a success. And even, for the toughest of cases that I see with dogs, and it can be pretty scary. You think it's the end at the start of it, and you get everybody through that. That is the biggest thing that brings me joy. And then to see that animal a year later still being healthy, it's what I do this for.
Wow.
And I think that too, when I first thought about vet med as a kid, I knew I wanted to help people, not just animals. And by doing that, by getting the whole team, owner included, to the end point that's a success, that's what I love. And that's why I continue to do what I do.
Well, it sounds very gratifying for sure. And the fact that you find it so gratifying is further proof that you picked your right destiny.
Absolutely. Absolutely.
Dr. Volturo, thank you so much. It's been so much fun to talk to you and so illuminating as well. I really, really appreciate your taking the time to do this. And I wish you well. Thank you for all the work you do for people and animals.
Absolutely. And thank you for having me and letting me get the word out about VetMed. And we hope to see everybody soon with their pets.
You bet. Absolutely. Thank you so much.
Thank you.
Bye now. Bye-bye.